In terms of therapies, well, our understanding of the disease has only become lucid in the last year or so. So we made a lot of mistakes. We saw trials with pretty good drugs and therapies trying to treat amyloid in patients who already had the disease. Well, that's like someone has congestive heart failure or a heart attack, and the cardiologist says, here, just take a statin. You had to do that 15 years before. So in many respects, the amyloid hypothesis didn't fail the trials failed the hypothesis. Now we know better. Now we know we have to start these trials much earlier and use prevention. So now we're seeing companies like Biogen and Lilly with immunotherapies against amyloid starting early on, even before symptoms. You have a person with a brain full of amyloid, but they're fine. You say, can we prevent Alzheimer's over 3 years or 5 years by giving a drug or a therapy that lowers the amyloid? I'm working on 2 drugs. One's called PBT2 that clears amyloid out from Prana Biotechnology, a company I started in my lab. I'm also using what are called GSMs, gamma secretase modulators, that stop the production of amyloid the same way a statin would stop the production of cholesterol. And the hope would be, whether it's immunotherapy or little white pills, that if we can stop amyloid production early on, you'd start doing that 15 years before symptoms. And those therapies are coming online now. We also see immunotherapy to stop the tangles from spreading. We see many pharma companies, AbbVie, Merck, and others who are getting into that. Inflammation is a bit behind because this isn't simply taking an ibuprofen or a COX-2 inhibitor or a steroid. You need to specifically hit microglial cells, which are being activated to cause neuroinflammation. Genetics from my lab and other labs have only recently identified the targets on microglial cells to stop inflammation, namely CD33 and TREM2. And now we and others are developing drug programs to hit those targets to quell inflammation in the face of Alzheimer's pathology. Right now, the drugs we have, like cholinesterase inhibitors, Aricept, Exelon, Reminil, help make the most use of what you have left. You know, they help boost up some cholinergic activity. They don't stop the disease from progressing. You add to that Namenda, or you know, you're hitting some of the glutamate excitotoxicity. These drugs are mainly treating symptoms. They're not really stopping the disease, so they're not even nearly sufficient for what we need. On the plus side, they can delay by years the time by which a patient has to go to a nursing home, and that's saving a lot of money in the healthcare system. But they're Band-Aids on a gaping wound. Other than that, for those who are in at-risk families, we can tell them about lifestyle changes that can help prevent risk. First and foremost, as usual, exercise. I like to say 10,000 steps per day if you have an iPhone that counts your steps, or a Fitbit. Diet, Mediterranean diet, less red meat. Sleep. I mean, clearly we've underestimated the value of sleep. It's during the deepest sleep that your brain cleans out gunk, the so-called glymphatic system, as we now call it, where glial cells are acting like the brain's lymphatic system to clear out amyloid and debris. Superficial sleep for 6 hours might not get you there. You might need 7 or 8 hours. So that's a big wake-up call. Excuse the pun. Didn't mean that. Synaptic reserve. So, you know, not Sudoku and Lumosity and puzzles and games, but actually learning new things, making new synapses to reinforce ones you already have, since all learning is based on association, and having more synapse to lose before you lose it. Those are the biggies that we talk about for trying to help stave off the disease. There are also some natural supplements that, you know, we're looking into. Ashwagandha, which is an Ayurvedic root, been used in India for hundreds of years, if not thousands. It turns out that helps clear amyloid out of the brain. Supplements like cat's claw from Peru that seem to help quell inflammation. So I don't discount their benefit and value as well.